Hi, let's learn together about rubella infection in preconceptional counseling. When a woman gets rubella infection during the first pregnancy, during the antenatal period, especially during the first 12 weeks of pregnancy, there is a chance for her baby to develop congenital rubella syndrome. Congenital rubella syndrome causes irreversible permanent complications to the child, including sensory deficits like cataract, glaucoma, then deafness, heart issues, neurological issues, and intellectual disabilities. So we are aiming to prevent all these occurrences by giving proper antenatal counseling to a particular patient. So when the patient come to you, the main focus is proper history taking, then the lab investigations to identify rubella infection status. We will be doing IgM antibody testing and IgG antibody testing. So to get an idea about it, I will be telling you the IgG antibodies are the response antibodies which we can find in our body as a part of infection or due to immunization, and IgM antibodies represents the recent infection. Okay, so if a patient come to you, there is two possibilities when we do the IgG antibody test. Patient can be negative or positive. If patient is negative, means patient has never taken any immunization or never has got any rubella infection. If the patient is positive, there are two chances. Patient has got rubella infection in the past, or patient has taken immunization for rubella. So if your patient is negative, IgG negative, suggest the patient that it is better to take a rubella infection before you get pregnant, and counsel her to take rubella infection immunization, and educate her to wait for 3 months to get pregnant, since the vaccination is a live attenuated vaccination. It can crosses the placental barrier, so it is recommended to wait for 3 months after the immunization. And now if your patient is IgG positive, the first chances patient is immunized. If the patient is immunized and it's been 3 months after the immunization, she can be pregnant. There is no problem. If she is immunized and 3 months is not completed from the date of immunization, she need to wait to complete 3 months, then she can get pregnant. Now she has an IgG positive, but the patient has not taken any vaccination, but this positive can occur due to exposure to the rubella infection. So ask the patient about the history of fever, rashes in the recent past. If the patient is giving these histories within 3 months of period, do IgM antibody test to detect that it is a recent infection. And if you are finding it is a recent infection, educate the patient that trying a pregnancy within 3-month period of time is riskier. So after 3 months of period, you can continue with the decision of getting pregnant. So this is about the counseling information related to rubella infection in preconceptional counseling. So the takeaway points are: rubella immunization is contraindicated in pregnancy. If a woman plans to get pregnant, she should take rubella immunization 3 months prior to the expected plan of getting pregnant. So this is about the rubella infection in preconceptional counseling. Thank you so much for watching.